The central nervous system, the brain and nerves, control when and how often a person needs to urinate. In order for a person to urinate normally, the bladder muscle and the nervous system must communicate with each other through special types of nerves. When the bladder is full, one type of nerve tells the bladder to squeeze down and empty the urine. On the other hand, when the bladder is empty, this nerve is quiet so that the bladder can relax and fill up with urine. These nerves work by causing the muscles in the wall of the bladder to contract. When these muscles contract, the bladder becomes smaller and urine is emptied. A second type of nerve tells the nervous system that the bladder is filling up with urine and that it is time to urinate. A third kind of nerve tells the nervous system when the bladder is irritated by infection or other problems. Normally these nerves are quiet because in a normal bladder there isn't any irritation. Overactive bladder is a common problem that can cause people to have distressing symptoms, such as inability to hold urine, difficulty with emptying the bladder completely, frequent urination, or painful urination. It is believed that one possible cause of overactive bladder is that the nerves between the bladder and the nervous system are not communicating properly. The type of nerves that normally should be quiet may become turned on in many patients with overactive bladder. It is not known why this happens in some people. When these nerves are turned on, it tells the nervous system that the bladder is irritated, even though it's not, and the nervous system responds by telling the bladder muscles to contract so it can empty. This is what causes the distressing symptoms of overactive bladder, such as the urgent need to urinate, frequent urination, or losing control of urination. Therefore, it is important to understand that the cause of overactive bladder in most patients may actually be a problem with the nerves rather than a problem with the bladder itself. Doctors usually treat overactive bladder with medications. These medications help relax the muscles in the bladder. Relaxing the muscles in the bladder may reduce the symptoms of overactive bladder. While these medications may work well for some patients, they may not be effective for everyone. Furthermore, these medications can often cause unwanted side effects like dry mouth and constipation.